Hello, I'm Dr. Kevin Kirby. I'm excited to announce that I'm going to be coming to New Zealand again. I haven't been there in 20 years to lecture, but I'll be there on March 17th of 2018 to present for the Foot Mechanics Seminar. This is a full day, one-day seminar that I'm going to be presenting at. We're going to be talking as the first lecture on tissue stress theory and how it's the new paradigm in treatment, not only here in America, but around the world for podiatrists. This involves finding the tissue that is injured, reducing the stress in the area, and increasing the efficiency of gait with our foot orthoses and other types of therapy. We're also going to be talking in our second lecture about this longitudinal arch load sharing system. I just had a paper published in the Spanish Journal of Podiatry earlier this year, and this describes this new concept of how the four layers of the tension load bearing structures in the plantar arch of the foot, along with the central nervous system, is able to produce a variable spring stiffness in the arch of the human foot to allow us to do the activities we can do both optimally and without injury. And also treatment concepts as to how we support this arch best with orthotic modifications. The third lecture is going to be on running biomechanics, which is a great issue for me because I was a competitive runner for 40 years. And we're going to be talking not only about the current concepts and controversies in running at this time, including foot strike and minimalist shoes, but also maximalist shoes, what the running gait cycle is like, and how best we can, as podiatrists, treat runners who have these running injuries that come to our offices. We're also going to be talking specifically about medial tibial stress syndrome, which is one of the most common injuries seen in the legs of runners. I'm going to be going through a full literature review and discussion of a new theory as to how this medial tibial stress syndrome actually occurs and how we can best treat it with foot orthosis modifications. And finally, I'll be doing two workshops in the afternoon, one on gait examination, both walking and running, on how to do a gait examination in the office quickly and effectively for our patients to see what the diagnosis is and how the gait is abnormal or normal, and also how our foot orthosis treatment is affecting gait. And the second workshop is going to be on clinical tests that are new for the podiatrist, including the supination resistance test, the maximum pronation test, the multiple tests we have for diagnosing plantar plate tears, the JAX test, Hubschur maneuver, subtalar joint axis location techniques are all going to be covered in this workshop. So we'll have a good day of education, and it should be fun to be back in New Zealand again, now 20 years since I last was there. Thank you.